Yeah, good morning, friends. Welcome back to the learning sessions for Metpure XL. Well, what we are going to talk about is the diseases. Well, first, we have already discussed in our past training sessions about these diseases, but I just want to highlight a few more things in detail because definitely we are promoting our drugs in cases of chronic heart failure. So let's start with it. So what is basically, or what are the synonyms used by the doctors for chronic heart failure? Well, it is also referred to as congestive heart failure or congestive cardiac failure. So CHF, and CCF all are synonyms. What happens in this condition is that the heart's pumping capacity or the power becomes weak and the blood moves sluggishly through the heart and the body. That means it moves with a very slow pace, or the velocity of blood is slow. So gradually over the period of time the pressure starts building up inside the heart. Well, the heart cannot pump enough blood to deliver oxygen and nutrients to the different parts of the body, and the cells start getting devoid of these essential nutrients and oxygen, and the body cannot meet. So the heart cannot meet actually the demands or the needs of the body. So how will the cardiac myocyte respond to it? Well, because of excessive volumes of blood inside the heart muscles, they start getting stretched. Well, enough they get enough stretch to hold more blood. But over the period of time, this capability of stretching and coming back to its normal condition is lost, and the heart muscles, they become stiff and thick. Well, this stiffness and thickness further damages or further hampers the blood from moving into the vessels and thus reaching the cells. It leads to weakening of the heart muscles, and the efficiency of the heart as a pump deteriorates over the period of time. It is unable to pump blood now efficiently. As a result of this, the kidneys, they respond by retaining fluid and salts. So the body becomes congested. So I'll show you a figure in the next of the slides where you can see how the body responds in the cases of CHF. So let's go on to the next slide. What are the risk factors involved in the congestive heart failure? Well, ischemic heart disease accounts for maximum percent of patients, or acts or the risk factor. It is approximately 62%. Well, smoking cigarettes 16%, hypertension 10%, obesity 8%, diabetes 3%, and VHD, that is valvular heart disease, for 2%. There are terms used as diastolic heart failure and systolic heart failure. It is just to familiarize you with the DHF and the SHF. Well, diastolic dysfunction, which is a condition of impaired ventricular filling, which means that the heart is getting filled with blood not in a proper way, or there is a dysfunction in the ventricular filling. So this leads to a term called as diastolic heart failure. So the heart failure with preserved ejection fraction, that is HFpEF, also known as diastolic heart failure or heart failure with normal ejection fraction. Well, in these cases the ejection fraction is maintained, however there is a dysfunction in the ventricular filling, or there is an impaired ventricular filling. So this is called as a diastolic heart failure, or diastole is a period of relaxation of heart in which the heart receives the blood, and when there is a dysfunction in receiving the blood and getting filled up, that heart failure is called as diastolic heart failure. In diastolic heart failure, the heart muscles contracts well, but the ventricle does not fill with blood well in the relaxation phase. So it is a relaxation phase failure. Now moving on to the systolic heart failure. Well, this is a systolic dysfunction, which is a condition of impaired ventricular emptying. So there is a dysfunction in pushing out or throwing out or pumping out of the blood outside from the ventricles into your circulation. So heart failure due to reduced ejection fraction is known as ventricular systolic dysfunction or systolic heart failure, or this is also termed as HFrEF, that is heart failure due to reduced ejection fraction. Well, there is a decrease in the ejection fraction of less than 40%. Well, in normal the ejection fraction, as you remember, is approximately 58%. So there are certain other terms which are used in heart failure. They are called as acute and chronic. Well, acute means there is a rapid onset, and chronic refers to a condition which is for a long duration. Chronic heart failure is a long-term situation and usually with stable treated symptomatology, which means that the patient is treated already for his symptoms. Well, there is a term called as referred to as by the doctors as acute decompensated heart failure, which means there is worsening or there is decompensation, and which will lead to heart failure. It is an acute event or it has a rapid onset, and this is characterized as having a change in the heart failure signs and symptoms resulting in a need for urgent therapy or hospitalization. Well, there is a term used as commonly as high output cardiac failure. Well, in this the ventricular systolic function is normal, but the heart cannot deal with the important augmentation of blood, which means there is an overload situation by the blood or by due to the serum infusions, or it can be conditions in which there is renal disease, there is chronic severe anemia, there is beriberi, that is vitamin B1 thiamine deficiency, thyrotoxicosis, Paget's disease, arterioventricular venous fistulas, arteriovenous malformations. All these are conditions which lead to an overload situation and can call and are termed as high output cardiac failures. So this is also a type of congestive heart failure. Well, going on to the next, heart failure symptoms are divided into left and right sides. Recognizing that the left and the right ventricles of the heart supply different portions of the circulation, the result is that the patients commonly present with both sets of signs and symptoms. So we'll talk about it in brief. We are not going to discuss it, or we don't need to remember it all in detail. So I'll just highlight what is left-sided failure. Well, increased rate or initially you need to understand what are the symptoms which are reflected by a left-sided heart failure. Well, there is an increased rate of breathing, there is increased work of breathing, that is there might be respiratory problem or the distress. Rales or crackles are heard initially in the lung bases, and when severe throughout the lung fields, which suggests the development of pulmonary edema, that is fluid in the alveoli. So rales and crackles are basically abnormal sounds which are heard by a doctor by putting a stethoscope on his lung or on his thorax region. So he auscultates with the help of a stethoscope and he gets these abnormal sounds which are called as rales or crackles. Then at times when they are severe, then probably there is pulmonary edema, that is there is water inside your alveoli, and when water mixes with air it produces a different abnormal sound that is called as rales, or it can be called as crackles. Well, these patients develop cyanosis because oxygen carrying capacity of the blood is reduced, which suggests that there will be hypoxemia, and this is a late sign of extremely severe pulmonary edema. Then you can also auscultate the apex beat, from which means that the heart is large and it will be displaced towards the outer border of the heart. That means, suppose if your apex beat is heard here around the nipples, then it goes laterally, it goes outwards. So it indicates that your heart has grown in size, it is enlarged. There can be abnormal rhythms which are called as additional heart sounds. This is called as a gallop rhythm, which may be heard as a marker of increased blood flow or increased intracardiac pressures. Well, there can be additional heart sounds like murmurs also present in cases of left heart failure. So these are basically the symptomatology when a patient comes to a doctor, and doctor, with the help of his clinical acumen, he diagnoses a condition called as a left-sided failure. Well, there's a right-sided failure. Well, the physical examination will reveal pitting edema, which means that there is water filled in the subcutaneous tissue, and when he presses on with his thumb, there is a defect which over the period of time it recovers back. That means the indentation which is created after some time, it comes back to its normal. Well, there might be ascites, which means that there is fluid inside your abdominal cavity. There might be hepatomegaly, which means there is increase in the size of your liver. Jugular venous pressures is frequently assessed as a marker of fluid stasis, which can be accentuated by eliciting the hepatojugular reflux. If the right ventricular pressure is increased, a parasternal heave may be present, signifying the compensatory increase in the contraction strength. Well, there are terms like backward failure of the right ventricle leads to congestion of the systemic capillaries, and this generates extra fluid or accumulation of fluid in the body. This causes swelling under the skin, which is termed as peripheral edema or anasarca. When this swelling is localized to your ankles, then it is called as pedal edema, and when this swelling is localized all over the body, then it is called as anasarca. So we have learned the terms anasarca, we have learned ascites. Ascites means accumulation of fluid inside your abdominal cavity, and so the cause and usually affects the dependent parts of the body first, which is called referred to as your ankle edema, sacral edema. When the patient is lying down, then it is near the sacrum. Well, these patients have frequent nighttime urination, which is called as nocturia, and may occur when fluid from the legs is returned to the bloodstream while lying down at night. In progressively severe cases, ascites and hepatomegaly may develop, while significant liver congestion may result in impaired liver functions, jaundice, and even coagulopathy may occur, which means there will be a problem of decreased blood clotting. So all these conditions are commonly seen with right-sided failure. So this is a picture which I wanted you to have a look at. Well, this is the term when we call it ascites, that is swollen abdomen. When you can see the pressure, when you can see that there is swelling of in the limbs or in the extremities or and all across the body, then it is called as anasarca. Well, when it is localized to your ankles, this swelling is called as pedal edema, and when it is near the sacrum, when the patient is lying, that is not exactly here, that is back, then it is called as sacral edema. So all these including the water or fluid, increased fluid content inside your lungs, this is called as pleural effusion, and inside your lung parenchyma, that term is called as pulmonary edema. So all these conditions are commonly seen in patients suffering from CHF. Well, there will be abnormal awareness of heartbeat, which is referred as palpitations. Well, it can lead to stroke and embolism. So these are the complications and the common symptoms associated with congestive heart failure or congestive cardiac failure. I hope that you have understood most of the things which I have tried to communicate, though it is a difficult session. So I need that you should revise it again so that you have a better understanding of CHF.